So I'll just introduce myself. I'm Giovanna Betancourt-Cohen. I'm a licensed clinical social worker at Sylvester, and I work primarily with gastrointestinal oncology, including neuroendocrine cancer. So I support the team here with anything that the patient or caregiver needs, from running the caregiver support group, because we know caregivers are also an important part of this puzzle, giving that support to caregivers, but also, okay, all right, to also helping patients identify financial resources to access medication cheaper or at a zero cost. We also provide short-term mental health interventions. So if you want to speak to your social worker about challenges you're experiencing, you can certainly ask your cancer center to speak to your social worker. If they're not able to provide that support, they can also link you to outside resources. I think since we have very little time, other things that we do as Sylvester as social workers, we also do, say if you need home health services, information about hospice, if you need a walker at home, we help coordinate those things as well. So make sure you're mentioning your needs to your medical team so they can best direct you to the social worker on site to help you with those resources. Thank you.
All right, so my name is Ana Gonzalez. I'm one of the registered dietitians working with this wonderful team. I have been in practice for about 4 years now, primarily working with pancreatic, neuroendocrine, and also bone marrow transplantations and home intravenous nutrition, but that's besides the point. Today, I just wanted to bring up the importance of nutrition, right? So nutrition plays an important role when it comes to these types of oncological cancers, right, or tumors. And the reason being is because most of them affect our GI, our metabolic organs. So a lot of the times we end up not being able to absorb the nutrients that we're consuming or use them appropriately. So talking to a dietitian that's an expert in those areas can help you identify not only trigger foods that may be causing your symptoms, but also areas where we can improve your digestion, improve your symptoms, and improve your quality of life. So I encourage you to reach out to your medical teams and reach out to the dietitians that are in the medical team to help you and guide you through this process.
Sorry. I was going to do it that way because they're bouncing off of each other.
Can I just comment? Yeah. One thing that I did want to comment before Misty starts is that for any of you who don't currently follow at our institution, if you're interested in getting an opinion from Dr. Chauhan, we'll give you the phone number. Once you have that first appointment, and whether you go back, it was just a second opinion, or you transfer, you can partake in any of the resources and support services at our institution that are available. Do not have to be your treating provider on a day-to-day basis. So if you've heard anything today that's interesting to you, but you're going back to your academic center in Raleigh and maybe they don't have all of these things, or back to New York or Chicago, et cetera, and they don't have all of these services where you are, reach on out. 305-243-5302. That's the registration number, and what you'll say is, I have the diagnosis of XYZ, and I'd like to see Dr. Chauhan, medical oncologist. If you'd like a surgical consult and your lung, you met Dr. Nugent this morning, you would say that. If your gut, I'd like to be seen by Dr. Merchant. And then they will ask for your insurance information and let you know if your insurance is contracted with our institution. Sorry for the interruption.
No, you're good. I was going to go over that too. So you're.
I didn't.
No, you're good. Teamwork. See, we all care a lot about it. So I have been in oncology for about 10 years, and I came down with Dr. Chauhan when he wanted to build a practice here. So I'm kind of doing a lot of different things right now. Our goal is to create an all-encompassing practice so we can make sure we have all the resources you need every form we need it. I'm mainly working with the Lutathera at this point, so that's the PRT. So we do a lot of things when it comes to scheduling those. The reason that it takes so long to get them started is we have to designate certain days that you can get treated on. We don't get to pick the day. We have to pick a day that they tell us that they can make the drug. The drug is specifically made for us, for you, for that day. We can't change it once it's done. It's a very in-depth process. So it can take 4 to 6 weeks, sometimes longer, depending on how much available there is. So those days are very important. So when we pick them, we try to pick the day that we're going to start, and then I try to give you all the treatment days at once. It's very overwhelming. I know that, because it's overwhelming to plan it for you. So that's why I try to give you all the information so we can both work on, does this work for you? Because at the end of the day, it's about you and your family and your life. I want this treatment to work for you, but if it interrupts you being able to see your grandkids or go to your brother's graduation, those things are important. We need you to be at the things you want to be in your life. So that's why we want you to call us, work with us. Even if it's not those specific treatments, if it's any treatment you're getting, whether it's taking a pill and how that pill makes you feel, if you don't feel better on certain days, work with us, call us. We want to be there for you to provide those types of accommodations as we can. You getting your treatment is the most important thing because that's what's going to help make you feel better. That's what our goal is. But we want to make sure that we're there in the ways we can be. So it's important to know ahead of time all of those information because we can't change dates once we get started. We can't play with the tools when it comes to Lutathera. That's a very specific one. Other medications, other infusions, those can be a little more adapted. Lutathera is a very specific thing. So it takes a lot to get those things scheduled. If you end up on treatments like those, any type of radiation therapy like they were talking about this morning, because there's more coming, those treatments are very specific. They're made certain ways. So it's not us being rude or not trying to accommodate you. Most of the time we can't move it, especially if it's like within 4 weeks, we cannot move things. It's a very tight schedule. But it does its job really well, so we want to use the best treatment for you. So just be patient with us, and we will do everything we can to work with you. But when we overwhelm you, tell us we're overwhelming you. We want to be able to do what we need to make sure you understand everything you need to know, whether it's where do I need to be or what is this medication going to make me feel like? Can I eat the morning of the medication? Do I need to take different medications? That's why we pull in Sasha. We want to know if you're taking certain medications, does that affect how the medicine works? Do you have to stop early or take it a different day? All of those things. I'm trying to help coordinate and build the program so we can make sure we're seeing all of those things up front. And that way you're not sitting in the room trying to remember everything in that one moment, because that's too much. It's too much for any of us to do, especially when we give you all the information and all the appointments all at once. So just know we know it's a lot, but that's why I'm here, is to make sure that you have a person and one point of contact to come back to, especially with that therapy, because there's a lot of questions. We give you a whole book of information, and then you go home and you're like, wait a minute, I didn't even know about that because we talked about it or we didn't talk about it, but a new question comes up. That's how it always goes, especially like Terri said, this is a disease that it's very different, and you're giving a lot of information, and even when you go home and Google it, there's so much out there, but is it yours, is it not? That's why the zebra's perfect. Everyone's a little different, but that's also why it's frustrating sometimes, is everyone's a little different. Definitely call us. Definitely let us know if it's not working or if that is what you need or don't need. What else can we talk about as far as resources? I really can't think. So individually, you need to ask your provider what they have. If you feel like you're not getting it, ask them for it. Be specific as you can be. That is the biggest take home that I want you to know. If you are not getting what you need because you're too tired every day, tell them, I'm too tired every day. I don't know why. Because sometimes it's little things like that we might not think to ask you specifically that will help us accommodate you in a different way. If you're too tired every day and it's because we're taking the medicine a certain way, maybe we can change that. Or maybe there's a way we can adapt what you're getting for certain days to help you feel better more days than not. So those are the big take homes. Make sure you ask what resources you have available and be specific when you're not feeling well. Tell us how things are, because your normal is your normal, so you might not be thinking of those things, but we need to know day in, day out how you're feeling, if it's changing, if it's not changing. with medication or without medication. Any of those things are very helpful. That's kind of why I'm here, is to help build a program that looks at those things and helps you remember those things. So we're here for you.
How many of you have portals where you can message your provider or your provider's team? And how many of you utilize it? Good. Number one, don't write an emergency in the portal. Because if we're not sitting in front of the computer performing other tasks, it will be too late. So my patient in this room, they have not had emergencies, but they know. If your comment in the portal is, I'm going to need a refill of my Zofran in 2 weeks, if your provider doesn't get back to you for 3 days, that's okay, because they have to prioritize, because your message instead of that might have been, I didn't get my Cape 10 delivered, and I need to start a new cycle in 2 days. So at least at our institution, if we don't answer right away, it's not that you're not important, you are so important to us, we just have to prioritize what the questions are. And in our practice, we do get back to everybody, I would say, within 24, 36 hours, depending on what it is. So just always think when you use your portal, it's not, we're not holding this and seeing what you just sent us on there. When you go to your appointments, does everybody have a notebook or a binder or a folder? Even if you're doing telemed, you should have that out. Write stuff down. When you write out your questions that you have for your provider, whether it be the physician, the nurse practitioner, also prioritize your questions.
I meant to give this example when I was going through my slides, but just another example of how confusing oral chemotherapy is and how important it is that we have you take it correctly. So this is one of my favorite examples. It's actually not a drug used for neuroendocrine tumor, but we have a patient, this particular oral chemotherapy, and sometimes we actually do this in neuroendocrine tumors too, is we start you at a lower dose, make sure you tolerate it okay, and then we'll go up to a higher gold dose over time if you're able to tolerate it. So this particular drug, what we do is the gold dose is that you take 4 pills every day. So we have them do 1 pill every day for a week, and then they go to 2 pills every day for another week. In the 3rd week, they take 3 pills every day, and then they can go up to taking 4 pills every day in the 4th week, as long as they tolerate it well. So this patient comes back in 2 weeks after we started, and we said, how's it going? How's the pill going? And they're like, this is fantastic. I love this drug. I have no side effects. I've never felt better. So we ask, how are you taking it? How many pills are you on right now? We come to find out they were only doing 1 once a week. So they said, I took 2 Sunday. We're like, well, what about Monday, Tuesday, Wednesday, Thursday? And they were only taking it once a week. So that's, it's good they felt great, but it's not going to be effective if we don't have you at a good dose. So just another, example reason, these are very confusing, and oral chemotherapy it's not the only thing on your mind. So it's just really important to make sure before you leave your doctor's visit, you know how you're going to take these pills, what your dose is. What we normally do is we set up a whole separate visit, either with myself or the nurse practitioner, where you go through that treatment. Sometimes it even goes up to an hour. We'll sit through, we'll talk through everything with you. But it's, you can have the best intentions, this even happens to, it could be a doctor, could be a patient, and they don't know that they need to take.
So we don't get upset if you get confused and you have to ask us again. It's like our backhand, but to you guys, it's new. If you're a chef and you know how to make, chicken cordon bleu, and you explain it to me, I'm definitely going to mess it up and have to call you back. So it's okay to call us. To us, this is not a job. This is what we do. This is our purpose. Get up every day to help you. if you're on Cape Temp, or if you've been on it and your hands have gotten red, dry, peely, and you haven't called, or if this happens to you in the future, call, because we can make an adjustment now so that it doesn't get worse and you don't lose time on the drug. Wait until you get to clinic at, let's say, day 26 of the 28-day cycle, and your hands, the Elmer's glue from kindergarten was peeled off and you're like chop meat. We're now going to have to hold, possibly a whole cycle. Now you're potentially behind the 8 ball. Call us, let us know. Don't be afraid. Oh, if I tell them, they're going to reduce my dose and it's not going to be effective and I'm going to be in trouble. Better to let us know early. Does that make sense?
All right, guys. Time flies when we are having fun, right? So, sorry, we are really running short, and we are almost at the end of our meeting. I would like to thank our panelists. I hope this was useful. It was definitely very useful for me to learn from my colleagues, and hope it was useful for you guys as well. Please, a round of applause. Thank you so much.